Instead of organizing mental health conditions around clusters of symptoms, we gain far more insight and can create more effective treatment strategies when we examine the underlying processes that maintain psychological suffering. One of the most important of these processes is something called experiential avoidance. By addressing these deeper mechanisms, practitioners are able. Syndromal classification, like the structure used in the DSM, relies heavily on lists of observable symptoms. While this provides a common language for diagnosis, it does not explain why disorders develop or how they are maintained. Symptoms evolve over time, diagnostic categories expand, and yet the models often fail to connect directly to treatment outcomes. A functional approach reverses the process. It begins by looking at behaviors in context and at the processes that drive them. This type of classification focuses on what is useful, what is predictive of treatment response, and what truly contributes to long-term psychological change. This work explores the limitations of traditional syndromal classification in psychology and proposes a more functional, dimensional approach. Experiential avoidance is presented as one of the most powerful functional dimensions we can use to understand psychopathology. It refers to the unwillingness to remain in contact with internal experiences, emotions, thoughts, memories, sensations, and the effort to alter, escape, suppress, or control those experiences. This pattern shows up across many therapeutic traditions, from psychoanalytic descriptions of defense mechanisms to client-centered views of blocked emotions, to Gestalt descriptions of resistance. In modern behavioral therapies, especially acceptance and commitment therapy, experiential avoidance is viewed as a core process underlying many forms of suffering. When a person becomes unwilling to experience discomfort, they often adopt coping behaviors that work in the short term, but create greater long-term problems. This dynamic is linked to anxiety, depression, and many forms of emotional dysregulation. Several factors contribute to why experiential avoidance becomes so common. Social learning teaches many people to suppress emotions, avoid vulnerability, and stay strong by disconnecting from their internal world. Human language also plays a role. Our ability to evaluate, judge, and label our internal experiences makes escape attempts more likely. And avoidance strategies typically produce immediate relief. Even though the long-term consequences may be harmful, the short-term reduction in distress is reinforcing. Over time, avoidance narrows a person's life and restricts their ability to adapt, grow, and change. A large body of research shows that experiential avoidance tends to backfire. For example, attempts to suppress unwanted thoughts often make those thoughts more frequent and intrusive. Emotion-focused coping strategies that rely on avoidance predict poorer outcomes across a variety of psychological difficulties. Chronic pain research demonstrates that patients who engage with pain and continue functioning tend to experience better results than those who avoid or withdraw. Those who habitually suppress thoughts and emotions tend to experience more depression, anxiety, and obsessive-compulsive symptoms. Because experiential avoidance is so central to suffering, understanding it can significantly improve treatment outcomes. A functional approach that examines the processes of avoidance helps therapists identify the mechanisms behind many disorders and tailor interventions that directly target those mechanisms. Integrating data from diverse research areas strengthens our understanding of human behavior and leads to better therapeutic strategies. The concept of self-relatedness further supports the importance of engaging with internal experience. Research shows that clients who are more in touch with their inner feelings tend to have better therapy outcomes. High levels of experiencing, the ability to feel and process ongoing bodily felt emotions, are associated with more successful therapeutic progress. Avoidance, on the other hand, disrupts this necessary emotional flow. Experiential avoidance appears across many forms of psychopathology. Although diagnostic categories vary, many contain subgroups of individuals whose primary difficulty involves avoiding internal experiences. The article discusses several examples, including substance abuse, obsessive-compulsive disorder, panic disorder with agoraphobia, and borderline personality disorder. In substance abuse, many individuals use drugs or alcohol as a way to escape negative emotional states. Although this strategy works briefly, it sets up a cycle of avoidance, dependence, and increased psychological distress. Some individuals expect alcohol or drugs to reduce their emotional discomfort, reinforcing the pattern. Substance use is especially common among people with affective or anxiety disorders. Treatment approaches that incorporate acceptance and emotional exposure show promise, though more research is still emerging. In obsessive-compulsive disorder, intrusive thoughts are distressing, and individuals use compulsions or mental strategies to escape them. These avoidance strategies keep the cycle going. Exposure and response prevention, where people learn to face thoughts and situations without performing rituals, is the most effective treatment. And research shows that trying to distract oneself during exposure reduces long-term success. Panic disorder with agoraphobia also illustrates experiential avoidance. Individuals react strongly to bodily sensations, interpreting them as dangerous. They begin to avoid situations where they fear these sensations may occur. The fear is not truly about the location, but about the internal experiences they anticipate. Treatments that help clients face and tolerate these sensations, rather than avoiding them, lead to much better outcomes. Borderline personality disorder involves intense emotional distress and frequent attempts to escape painful internal states. Behaviors such as impulsivity, self-harm, or sudden shifts in mood often emerge as efforts to regulate or escape overwhelming emotions. Dialectical behavior therapy is highly effective for BPD because it integrates acceptance, emotional tolerance, and mindfulness, helping clients stay present with difficult experiences without resorting to self-destructive avoidance patterns. The article also discusses suicide as an extreme form of experiential avoidance. Many individuals who contemplate suicide are not diagnosed with a mental illness, which suggests that unbearable emotional experiences alone may drive this behavior. People often seek escape from guilt, shame, fear, or anxiety. Effective treatment helps individuals learn to accept and tolerate distressing internal experiences rather than trying to eliminate them at all costs. Childhood sexual abuse is another area where experiential avoidance plays a significant role. Survivors often experience deep feelings of guilt, shame, fear, and confusion. Many adopt avoidance strategies to cope with these overwhelming emotions, and those strategies predict poorer psychological functioning later in life. Treatments that gently and safely expose survivors to their thoughts, memories, and feelings, rather than encouraging avoidance, tend to produce better long-term healing. Acceptance-based treatments focus on reducing the struggle with internal experiences rather than trying to change the form, frequency, or intensity of those experiences. These methods show promising results across many disorders, including substance abuse, borderline personality disorder, and agoraphobia. The overall movement toward acceptance-based and process-focused interventions reflects a growing recognition that experiential avoidance is one of the most important dimensions in understanding and treating human suffering. This work highlights the need to shift from purely symptom-based diagnoses toward a functional understanding of psychological processes. By focusing on experiential avoidance, clinicians can better understand the roots of behavioral disorders and apply treatments that enhance long-term resilience, emotional flexibility, and psychological well-being. These healing techniques are outlined in our Genetic Recoding and Panacea system. Explore our programs, continuing education, and professional development at holisticschool.online. Or start your transformation with a deep dive self-healing workbook at liberatedliving.com/liberated library. This video production is part of Liberated Learning's certification program series, offered through Liberated Living. We've made it available to the public so that anyone can benefit from holistic health and wellness education. To explore our programs, continuing education and professional development opportunities, or learn how to become a licensed or board-certified professional, follow the link provided or visit holisticschool.online.